I want to talk about COVID-19 vaccination strategy. So we have a new president and declared 100 million people in his first 100 million per day. All right, let me see if I'm on. I'm going to check, and I'm going to share, give a couple of minutes while I wait for this to sign. Just give me a couple of minutes, guys. All right, let's see. All right, so welcome. Some people on COVID-19 vaccination. We have been having a lot of patients calling us, getting the vaccine. When are you getting the vaccines? We have applied for the vaccine and we're still waiting for approval. But COVID-19, 100 million vaccination in the first 100 days. That is amazing if that could happen. Let's take a look at what has happened so far. So initially, we know that the healthcare providers, frontline workers were the first to receive the vaccine. Now, of course, not all healthcare providers have gotten vaccinated because, of course, we have not vaccinated the amount that the first president wanted to vaccinate. So it was the healthcare providers, first-line workers, and then the elderly over age 65. But we're still waiting. So what will be different this time? You might be asking, so what will be different? Because there's so many people waiting. So let's look at the good points in this current national strategy. So first of all, the idea is to vaccinate more people, not only frontline workers and the elderly, but more people, whoever want to be vaccinated. That's one thing. The other good thing is that there will be a detailed, structured manner in having more centers that will do the vaccination. So we'll have more location. We'll have more other organizations like FEMA involved in vaccination. And then, of course, what I like also is to activate pharmacies. You can go right down to any pharmacy and get the flu shot. Then the same thing should happen by you going down to any pharmacy and getting the COVID-19 vaccine. Now, in addition to pharmacists, they'll be setting up clinics and centers, various centers. Now, there are hundreds of thousands of primary care physicians in this country. If we could receive the vaccine on time, then that is another way in which the various clinics and centers, not only hospital, could be vaccinating the patients. Now, of course, you might be thinking, all right, so we're going to have 1 million per day for 100 days. Now, what about production? So President Biden has discussed that he will be also promoting more vaccination production, because it's one thing to say you're going to provide 100 million a day, but then you're short. So in 21 days for the Pfizer vaccine, nothing available. 28 days for Moderna, nothing will be available. So the production will have to be stimulated. We have to have the vaccine in order to vaccinate. And then, of course, President Biden said he will not change the current structure. So, of course, we know that for Pfizer, the vaccine is given first dose and then 21 days, the second dose. And then for Moderna, it's 28 days. So, of course, we want to ensure that everybody gets the vaccine. And, many offices, patients have been calling our offices, when are you getting the vaccine? And I'm sure other healthcare providers, if you're on the line, you're also hearing the same thing. everybody will, of course, want to be vaccinated. There's some people who are hesitant still, want to learn more about the vaccine, and are waiting. But right now, we're having difficulty getting the vaccine. You apply and you're told then there are no updates. We don't know when you'll be approved. Just wait for an email. So if you're listening, if you're my patients and you're listening, the vaccine will be coming. We're not sure yet when we'll be getting them, but let's hope that with this new government, we will have more vaccine available to the medical offices, to the hospital, to the various vaccination sites that will be set up. And pretty soon, there's still many. This weekend on Sunday, I will be doing a webinar on the COVID-19 vaccine. If you're my patient, call the office or look for a link in your cell phone. We'll be sending messages out so that you can learn more about the COVID-19 vaccine. So 100 million vaccine in the first 100 days, that will be amazing. Of course, we need to vaccinate as many people as possible in order for us to have herd immunity. And I will be giving you much more information on COVID-19 vaccine come this Sunday night at 8 o'clock. All right, guys, I'm going to sign off. Just excited to know that in the near future, hopefully with much hope, that many of my patients, many of you listening, will be vaccinated from this COVID-19 infection. So I will see you soon. Bye-bye.